prefer something like this for your feeding tube. For a lot of people, they prefer the low profile style. This is a style of feeding tube that doesn't have any external tubing. When you go to do your tube feed, you attach an external extension, which slips in right here. You give it a twist, it goes in, and that's how you would do your feeds. So for a lot of people, this style feeding tube can be beneficial because it can enhance their sort of body image if you are tube fed, that you don't have so much tubing and plastic hanging outside of your body. It can be more comfortable because you don't, again, have all that tubing that has to be put to the side or put somewhere, tucked into your clothing. I think it also reduces the likelihood of a person pulling their tube out, whether it's on purpose or by accident. So for kids, for example, there's a lot less to grab and pull with this style compared to something like this. Some people call this style of feeding tube a dangler. The clinical term that I use is a long shaft design feeding tube. And there's nothing wrong with this type of feeding tube. It's just that there are some people who understandably are looking for something that's a bit more discreet, whether for their child or for themselves if they're a tube-fed adult. So I think it's important to know that these tubes exist. They may not always be an option for every single patient, but they're something worth asking about if this style appeals to you. Another couple of things to think about with this is that I think might be interesting for you to know, is that they do come in different depth because everyone has a different size abdominal wall. I mean, I'm sure that there's lots of people who can fit the same size feeding tube, but there are some people, especially, for example, like a large adult is not going to have the same depth of abdominal wall as a child. So that's why these tubes do come in different lengths. So for example, this is obviously a long one that would be used for an adult that would have quite a thick abdominal wall, because this is going to be on the outside of their body and this is going to be in the stomach. Versus something like this one that's short, because it would be intended for somebody who has a small abdominal wall, probably a child. And it's also a smaller French size. So they do also come in different French sizes, which is the diameter of the external part of the tubing. Just briefly about the extension sets. You can certainly use this style of feeding tube for Blenderized tube feeding, but just something that I wanted to point out is the extension sets. There it is. There are two different kinds. This is what would be called a bolus extension set, and this would be like intended for continuous tube feeding or pump delivered formula. Both can be used for Blenderized tube feeding. I've certainly seen it done by many, many patients. This one being thicker would seem like a better option, but it still goes to the same or nearly the same narrow opening. So you can see both of these have very small openings at the end. So the tubing here is wider than the tip. And the same with this one. Even though this looks really thick, everything has to make it through that tiny hole. The connection point here is tiny. In my opinion, there is some advantage to that narrow point, and the big one is that if you were to have a piece of solid food that's not properly blended, even if it can make it through this tubing, it may not make it through here. So this is going to filter out any potential blockages, and if it can make it through here, for most feeding tubes, that's actually narrower than the tube itself. So you can imagine if you're an adult with this larger size feeding tube and you're using this extension set, even if you had a particle of food that was maybe not perfectly blended, but was small enough to make it through this little hole, if it can go through there, I don't think it can block this size of feeding tube. So in a sense, you're getting some kind of protection from potential blockages because of how tiny this hole is compared to the diameter of the feeding tube. Hopefully that makes sense. If you're a tube-fed person or you have a tube-fed loved one and you're interested in switching to a low-profile tube, if you do have that long shaft tube design, talk to your healthcare team about it and see if it might be an option for you. All right. if you have any questions, leave me a note below and I'll get back to you. Thanks. Bye.